You know, a lot of local families are impacted by autism, but people don't always know where to turn for support. Michelle, that's where you come in with Blooming Behavior Services. What are some of the services that you're offering?
Thank you so much, Ashley, for having me. The services that we actually offer early intervention for children under 3 years old. We also provide ABA therapy to children that have an autism diagnosis, and we also do provide parent training.
Well, this is a perfect time of year to have this conversation because April is Autism Acceptance Month, and you do in-home therapy so that the kids and families are comfortable. What are some of the early signs or detection signs that families may notice?
Sure, great question. So early signs are so important to pick up on. I really want to tell parents to really think about, trust your gut feeling. If you feel like something is going on or might be off, talk to your healthcare provider. It's also important to look at their communication, their social skills, play skills, and also as their restrictive and repetitive behaviors. We really want to compare those to the developmental milestones. Are they meeting them? A good guideline is to look at the CDC website, and the milestones will help guide parents there.
Why is early intervention so crucial for these kids?
Yeah, so 0 to 5, our brains are just growing so fast, and there's so much plasticity that's happening. Having early intervention can really help children reduce frustration, increase their independence, and also allow them to access their environment just so much more easily.
You know, you said that you're going into people's homes. Nobody's coming to an office and sitting on a couch or anything like that. So that's one way that you personalize your services. What are some of the other ways?
Yeah, so we do a 2-day intake where first we interview the parent. We really want to get to know that child very well. We also collect assessments from other providers that they see, so maybe speech, OT, or even their IEP team as well. We provide them individualized assessments based on their age and where their skills are at. We also want to make sure that we create individualized goals that parents are on board with. If parents are on board, then it makes everything so much easier.
Let's talk about the parents for a second, because this isn't something that a child is going to navigate on their own with you. I mean, it is so important that you work with the parents and maybe siblings. So what are some of the ways that you're working with the rest of the family?
Yeah, so we do provide parent support, and in those they can ask us questions, seek guidance. Parents are the most crucial people in the child's life, and they're most consistent. They can also provide hundreds, if not thousands, of learning opportunities outside sessions. So we want to make sure that they're on board with all the goals that we're working on, and those skills are generalizing outside of therapy sessions.
Do you have any advice for parents that might be just feeling overwhelmed by all of this? Because that's got to be a very stressful time to get a diagnosis, or maybe even at home when you're noticing things before getting a diagnosis. Any advice to, combat those overwhelming feelings?
Definitely. I want to tell parents I feel for them. Navigating the healthcare system is just so complicated. Definitely contact a trusted healthcare professional, and if they are ready to get started and have that diagnosis with ABA, give us a call. We have a trusted team that's happy to help them, and a dedicated family success liaison that can walk them through the entire process. We do provide ABA therapy, throughout San Diego County, and we're actually accepting new patients right now between 8 a.m. and 2 p.m. Monday through Friday.
Wonderful. Well, what drives you? Why are you so passionate about helping families navigate autism?
Honestly, I've always been intrigued in the medical field ever since I was really little, and my parents definitely wanted me to be in healthcare. The first kiddo that I actually worked with in ABA, I kind of stumbled into the career, but he actually did not have verbal communication. And I got to see his first words just within a few weeks of working with him. And it was just incredible to see. Those first words went to phrases, to sentences, to actually, while I started to end working with him, he actually told me about the dream that he had the night before, and we're having a full-blown conversation. So I was just completely bought in from the beginning, and it just kind of where my passion met my purpose, and I really wanted to open up my own private practice to make sure that families were really taken care of, from the kids to the parents, and then also just the people who work for us. They're so important, and they do such a great job. We want to have a very supportive work environment, and also a place that's very values-driven.
Well, what you are doing is amazing. We've got a full screen for all of that information. I know Michelle covered a lot, so take a picture of that. Don't even try to write it down right now. Take a picture and get in touch with Michelle and her team. Thank you so much for your time today. Really important conversations. Don't go anywhere. We'll be right back.